I was asked to talk about vaccines while trying to conceive. Which vaccines should you be taking from a medical perspective? So I wanted to go through my recommendation when you're trying to conceive. I'm Dr. Rogers, I'm a fertility doctor, and I will tell you what I think you should know. There are two viruses that can cause really devastating congenital birth defects. The first is rubella. Rubella is part of the MMR vaccine. Congenital rubella causes major birth defects, including deafness. That is one that we test for blood in the blood to make sure you are protected. The second is called varicella. Varicella is the chickenpox virus, and congenital varicella causes major birth defects, which I'm not going to show any pictures or talk about the horrible birth defects. You can look those up on your own time if you'd like. But we recommend you're vaccinated against varicella before trying to get pregnant. That's an easy blood test. I check all my patients to check to see if their titers of varicella are in a good range. Everyone has either been vaccinated against varicella or they've had chickenpox as a kid. Some people lose their immunity and need a booster shot. And that is also a live vaccine. It is not recommended to give during pregnancy, and it's a series of 2. So you get one, 4 weeks later, get one, and so you have to delay trying to get pregnant for 2 months from the beginning of that vaccine series. Other vaccines, of course, that I recommend, that's recommended for pregnancy, certainly flu is a yearly vaccine. The flu in pregnancy can be really dangerous, can increase the risks of miscarriage, and maternal risks have an increased chance of the mother getting severe pneumonia to the point of increased risk of unaliving. Talk to your own doctor about what they recommend for you, but as a fertility doctor, a board-certified reproductive endocrinologist, if you're trying to get pregnant, make sure you're protected against varicella and rubella and get your typical annual vaccines.